This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
A program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome Dr. Ian Arra, who is the Medical Officer of Health and the Chief Operating Officer for the Health Unit here in Grey Bruce. Dr. Arra, thank you so much for joining me today. Always there are updates that you have to provide, and it seems like things are changing almost as we speak with COVID-19. So welcome.
Thank you, Carol, for having me. It's always a pleasure to be here.
First of all, I want to ask you how you're doing. This pandemic has gone on for such a long time, and you and your staff have just been amazing in helping our community through this. But how are you doing?
Thank you for the question. The staff and myself, it has not been easy, but we're trained to do this, and we have the commitment to serve the community, and I know that we will continue to do so. It's a unique combination of a sprint and a marathon. Usually when you have a sprint, you have a period to recover and relax after, but we have learned to pace ourselves, and obviously we'll continue to do so.
It hasn't even been a stop and go. It's just been changing pace and changing direction. So I'm glad that you're doing well, and certainly we appreciate the service. Thank you.
Thank you.
Tell me about the current COVID situation in Grey Bruce. I know you'll be talking locally, and anything you want to share provincially as well. We're happy to hear that too.
Certainly. So locally, it is as good as it gets for a fourth wave. We have no outbreaks in any of the sectors, whether the high-risk sectors, hospital, long-term care, schools, or in the other sectors, whether it's business or organizations in the community. This is directly related to the effort that have invested by everybody around the table, the public, following the recommendations, getting the vaccine, and the organization implementing the measures. It is truly an honor just to see the results. When we see an average of new cases of less than 5, that does not happen as a coincidence. It is a lot of effort, and it is quite manageable. And we have good confidence this will continue, hopefully until we get the herd immunity and the transmission of the virus will cease to exist. The pandemic will evolve into an endemic, and the word endemic just means it's going to exist, but it is not different from any other disease that humans live with. And we need to remember, and this is my own bias, and a number of, I would say, a sector of the expert in the field would say COVID-19 is a coronavirus, one of the family of coronaviruses, also known as common cold. And there is potential for evolution where when we have the immunity to it multiple times through booster doses, 2 or 3rd dose, or a wild infection, the acquisition of the disease down the road might not be as severe. So it will be hopefully the eventuality of it. The other part of the experts would say it's something that we have to live with and have booster shots similar to tetanus or to influenza. Either or, it's going to be an endemic. So back to the question, it is as good as it gets at this point, quite controlled. Provincially, we've seen different activities of the virus across the province. Recently, Sudbury, I believe, Kingston, there was quite a surge similar to the one we experienced in the summer, and we managed to actually put out completely or put out within 3 weeks to 4 weeks. We were the shortest hotspot in the province in Grey Bruce, and that's again attests to the fact that this virus does not have a rural area or remote or any other variable. It is the effort of the public and the community. So we've seen these activities across the province, and public health response accordingly, and there is quite the support from the province. So we have developed the systems we need to ensure the response does not require the level of urgency and emergency that was required early on. And that really goes to the definition of emergency, but that's a different discussion if you wish to go into after the other questions.
So it's interesting that you use the word endemic, which is the first time I've heard it used in relation to COVID-19. So that, in a way, is a positive thing. We're moving away from pandemic mode in the future. So that certainly is a reasonably good phrase, better than pandemic for sure. Now, the third dose of the vaccine. I just read an email that came through about the third dose, and there's a significant part related to the timing when you should get your third dose. So I'm wondering if you can speak to that.
Yeah, so the third dose has different classes within it. The first two were related to the most vulnerable of us, people with immunocompromised system or people who are living in long-term care, retirement homes. So these groups were prioritized, and we completed their vaccines for the long-term care and retirement homes in September and October. And immunocompromised individuals will continue to be offered the vaccine as we proceed. About 2 weeks ago, the province announced the third dose for another group of the least protected or the most disadvantaged immunity-wise, individuals 70 years and older, indigenous communities, healthcare providers, and including first responders, police and fire. In Grey Bruce, I would definitely look at the activities that those sectors provide, and they're very similar to the paramedic activity that all three services attend and sometimes fulfill the role of each other whenever needed. So the vaccine is offered to all these groups. So there is a recommendation from NACI and from the province to have to have 6 months between the second dose and the third dose. And again, this is not bad news for people who don't qualify yet. All it means that the immunity from the second dose is quite sufficient to protect them at this point. And we will absolutely provide the vaccine when the time comes for a booster shot for them.
So people who are wondering, should I just go ahead and get that third dose, whether that's that 6 months, your advice is no, wait until the 6 months have expired since your last dose before you consider getting the third.
So this is the eligibility criteria right now for individuals who are in these groups. They need to wait for 6 months before getting that dose. And it's worth mentioning the access is available across Grey Bruce. We have worked with pharmacies and some of the family health teams that are onboarded to provide the vaccine. And the health unit is providing clinics on a daily basis across Grey and Bruce in the 17 municipalities. The schedule is on our website, and we update it quite often.
So lots of places to get when you're eligible to go ahead and get that third injection as well. And that you anticipate those sites will continue over the next few months being available for people?
Certainly. We've been working with the municipalities to ensure there is a community center in each one of the 17 municipalities in Grey Bruce. And thanks to the staff and the volunteers from the municipalities who are supporting and helping our staff to ensure that delivery is available for everybody.
This is the marathon part, right?
Yeah, you see, Carol, like when we were looking at the mammoth task of vaccinating, offering the vaccine to 170,000 people, 2 doses a year ago, we had to be creative, and we definitely delivered on that with the mass immunization. Then all these systems would adapt and be beefed up wherever needed to ensure it's going to be down the road just another program that provides the vaccine similar to measles or pertussis. And obviously we're not at that stage, especially with the third dose. Right now it's for the 70 plus, but it is anticipated by the end of the year and in January of the next year to start providing the vaccine to all the public, a third dose at that time.
Yeah. So a couple of other questions regarding that, the booster. People are wondering, it's flu shot season. And people are wondering, well, if I'm going to get my flu shot and I'm eligible for the or even any of the COVID injections, not necessarily the booster, can I have both at once?
Most certainly, yes. NACI's recommendation, the National Advisory Committee for Vaccine, approved giving the vaccine at the same time or at any interval between the two shots, but obviously it's more practical to go for one trip and get the 2 doses. And it's definitely added protection for the individual, for the family, and for the community through the healthcare system. We know that the flu consumes part of the resources in the healthcare system on an annual basis, and COVID does too. So there is that dual function. If a person gets the vaccine for one or for both, definitely is protecting other people around them.
So certainly a good idea to just get the injections, and if it works that you can get both at once, there's no reason why you can't.
Well, definitely, there's all the reasons why a person would do both at the same time. It's one trip. It's worth mentioning our board members really started the rollout of the vaccine in our clinics, and a number of them had the shots. We put it as a media release to encourage people to follow the example.
And I also saw the images of you delivering the vaccine actually to, I'm assuming it was the board members as well. I thought that was a really great picture just to demonstrate, we're not just saying it, we're doing it. We're leading the way and we're demonstrating that we mean it when we say get vaccinated. So I thought that was a really, really great picture. So, parents are concerned about their children, and there's some recent news about immunization for children. What is the status, and what would you say to parents who may be concerned about whether they should or should not proceed?
So again, the data about the safety and efficacy of vaccine is entrusted in one of the most incredible organizations, NACI, National Advisory Committee for Vaccines and for Immunization in Canada, similar to the FDA. And they've ran their assessment, and I believe the announcement is going to be today, if it has not come out yet, which is November 19th, where the approval will take place. We know from surveys in Ontario, provincial survey, that around 50% of parents are ready to provide the vaccine to their kids. We know that there are 25% who would say, I don't want the vaccine to be provided to my child, and the other 25 would say, not yet. I wanted to wait a bit more and see the safety and efficacy. We know that NACI, when they put their stamp, if they approved, that means all aspects of safety and efficacy has been explored. And if we step back just a bit and look how many doses have been given of these vaccines worldwide, we're talking over 5 billion doses. And the safety profile is quite robust, efficacy as well. And there are certain studies, they're called bridging studies in the technical term, to generalize the safety profile and efficacy from the adults to the children, but they're not done lightly. They've taken actually longer time than I expected. Usually they're done in 3 to 4 months, and now we know that that has exceeded that. It's almost a year since the vaccine is out. So again, safety and efficacy is there, but I do realize that parents would want it to take all the time to make the decision and look at the data. So I would invite them to invest 10-15 minutes per day for a few days to look at NACI's website, the Health Unit, Public Health Ontario, or Public Health Agency of Canada. Those are credible organizations to look at the data. And people would definitely make the best decision for their children with the information at hand. We all need to remember that not getting the vaccine is also a decision. Some people say, like, I don't want to make a decision. Well, by not giving the vaccine, you are actually making a decision for the safety of your child. And if I can finish that answer, Carol, with the fact that each individual is different. There are certain families, there are certain individuals who have different health needs, and depending on the health conditions in other household members, it could be very, very essential to get the vaccine for the children. And some other people, I would respect their opinion if they decided to wait and look at different aspects of it. But it is important to make an informed decision and learn about the safety and efficacy of the vaccine.
So a pause on the decision is still a decision. That's really what you're saying. Yeah. We're heading into the holiday season, Hanukkah, Christmas celebrations. What advice can you provide to people who are most anxious to get together over the holiday season?
Well, in Grey Bruce, we have managed, and I'm using the societal we, all of us, the public health, the healthcare system, the leaders in the community and the public, we've managed to have optimal control over the pandemic at almost all times, except for a few junctures of middle of waves. And that really, the investment to be able to loosen the restrictions as soon as we can, so long it's safe. So in Halloween, for example, last year, we had stringent measures. This year, we encourage people to celebrate in a safe way, to still be vigilant, but at the same time, take opportunity of the fact that the numbers are low and have that human connection that is needed for all of us, for our mental health, for our mental well-being. The holidays are important time to have that connection, but at the same time, again, we need to be vigilant. We can celebrate in a safe way. For people who have health conditions that might be a weakness or not a weakness, sorry, predispose them for complications, they need to be more vigilant. Getting the vaccine for everybody would definitely be a surplus for that family and the community. If people are not vaccinated, to celebrate, considering some physical distancing, using masks, hand washing, to be vigilant about those things. We need the best for our family and friend to get together in a safe way. And it would be very detrimental if our visit or our celebration can bring something that affects their health negatively. But all in all, I would say in Grey Bruce, we are in a good position to have reasonably safe celebration with the measures in place.
Mm-hmm. Yeah. You know what, you raise an interesting point, and it reminds me of a conversation I had with someone who said, you know, I'm not getting vaccinated for myself. I'm getting vaccinated for my grandparents because I want to see them, and I know they're in the high-risk category. So I don't want to feel guilty if I happen to accidentally be the reason why they get sick. And I thought that was an interesting perspective I hadn't heard. But I think you're alluding to that kind of concept where it protects others, not just yourself, when you're visiting or celebrating.
Most definitely.
Yeah.
Most definitely, and it's not just a family, like you rightly said, the community. If we reach, or when we reach or surpass the 90% herd immunity, that herd immunity is going to protect everybody, the vaccinated and the unvaccinated. And if I may go into that segue, it's really important for all of us to be patient, to continue to be patient, to be kind, and this holiday season is the time for it. It's so easy in the hardship of a pandemic to forget where the hardship is coming from and point the finger to the others, whomever these others are. Could be the visitor to Grey Bruce or the decision maker, or unfortunately recently the healthcare providers became the other. Somebody will point the finger and say, that's the source of my hardship. Similarly, the people who decide not to get the vaccine should not be the target of exclusion. Rather, it's a decision that they made, and again, the herd immunity can protect everybody, including them. And we need to remember there's life after this pandemic, and we need to tackle many other things, whether it's social or emergency related to opioid or others. And we need everybody around the table to be there. And the holiday is another reason to remember to be kind and to continue to be calm and patient.
What I am hearing and seeing in the community, people are getting frustrated. They're getting tired. They are starting to be a little bit more easily irritated. So your comments are well taken. It's been a long haul. We're not through yet. We look forward to the time when we don't have to wear masks. I'm not pinning you down to a date. But do you think by spring of next year, there might be hope?
I am very hopeful by the spring, and I was very hopeful to actually, sometimes enjoy the thought about that announcement where we'll say there are no more masks, and the herd immunity was 75 for COVID, and we did reach it on target in July, but obviously the Delta variant is a different beast and changed the equation. By the spring, I would say it's a very reasonable time to say this is going to be behind us. Carol, the recent data about the serology, Canadian serology study, might not be the exact title of the survey, but it looks at the immunity in the population in general. And the immunity comes from two main sources, the vaccine and the wild infection, the infection with the wild virus. And the combined immunity level is actually around 94, 95 in general, which can justify where the transmission of the virus has slowed down in hotspots in big cities, despite the fact that herd immunity has not been reached from the vaccine itself. Yeah. So that is reassuring that over the coming few months, obviously we're going in a slow but steady increase in the vaccine coverage, and we will see the booster shots, and we will see that people who acquired the vaccine because they didn't, acquired the virus because they didn't acquire the vaccine, actually acquired immunity from it. So the total of it will enable us to see the transmission of the virus to slow down and diminish to an endemic state, and at that time, ripping off these masks would be warranted.
We do need a party. You do know that, eh? When everyone can just bring their masks and just say, take it off. We're done with this.
You can say that again. I can see people being creative in the way they dispose of them or create some ceremony around it.
We absolutely must have some sort of celebration around that event. There are still some vaccine or vaccination hesitancy with the public. Are there any words of advice or encouragement that you could provide to help even more with those who remain hesitant?
Yeah, definitely. The safety profile of the vaccine really speaks for itself. Like I mentioned, 5 billion doses or more than 5 billion doses provided globally, and the adverse events are quite low. The efficacy is there. You know, I do believe in personal choice, and I do believe that each person would want the best for themselves and their family. So investing 15 minutes per day for 3-4 days to learn about those vaccines and to avoid misinformation from the social media or from the internet in general, but focus on the credible sources. That's where I would advise people. I would never say to a person, take the vaccine or don't take it. Rather, I would encourage you to learn about the safety and efficacy and make your informed decision to protect yourself, your family, and the community. And you look at the vaccine acceptance rate in Ontario and Grey Bruce, all health units are within a small margin of difference. We are, I believe, 1 or 2 percentage points under the provincial average, but there is no significance in the difference. And that average is quite high, which really speaks to the campaign and providing information, to the awareness from the public and the understanding. there's not going to be 100% vaccine rate. We know that. And we just encourage the people who have not received it to learn a bit more about it.
Yeah. There is a phrase called recovery phase. Can you tell us what recovery phase is? I know we've just got a few minutes left in the program, but what does that mean?
Yeah, in the cycle of emergency management, if a person Googles Public Health Ontario emergency management, there are 4 or 5 stages depending on the source, which is preparation for emergency, mitigation to the effect, and response, which we have been in, then recovery, to going back to our normal operation. And in each one of these stages, the system would learn. So you take an example of testing. We started by 2,000 tests per day. Now we have capacity of 50, 60,000 per day. And so in the recovery, we would rearrange our lab capacity to prepare for the next emergency. Hopefully it's going to be years from now, but we need to be prepared. And that recovery part has that aspect of it, to prepare for the next emergency, but at the same time to go back to our normal functions. We have other vaccines to children, we have maternity care, we have early childhood care that we provide in the health unit. So we need to go back to these programs and align them in a way to best address the health need in the community. And we really need to remember something I probably mentioned multiple times, but it lends itself to different aspects. Our goal in public health and the management of this emergency, infectious disease pandemic, is not to lock it down. It's actually quite the opposite, to open as fast as we can so long it is safe. So when we get to this recovery period, and we've started this months ago, and obviously the Delta was a setback, but it's still in the process, that lens is always there. Our goal is not to say the holidays should be a lockdown and people should not meet with each other. Rather, no, please have the best mental health you can, so long that you're safe and protecting others. And that's in general one aspect of the recovery. Recovery phase is the most complex part of the emergency in general, but we do have the expertise, we do have the local political will, we have the good connection with the provincial level, and all these things will go forward to ensure a better public health service to the community and preparation for the next emergency that hopefully will be years from now.
Thank you so much. The word recovery just makes me beam. I'm just so excited. So I want to thank you, Dr. Arra, for sharing this update with us, and again, for everything that you and your team are doing for our community. And I certainly look forward to talking with you, hopefully in another month or so, to get even more good news for our community. So please take care of yourself. And thank you to our viewing audience as well for joining us today. Take care, stay safe. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Hi, I'm Callie Ewins, defenseman with Olmstown Attack. Go behind the scenes with your favorite team on Attack Craft every Tuesday on Rogers TV.
I'm Wendell Clark with a word about winning. We all know it takes a team effort in any sport and with any challenge. You can be a part of the winning team that shuts out impaired driving. Whether you're out on the town